Assalamu alaikum. This is Nur al Huda, and you're listening to my review of Endometriosis From Harm to Hope, a chronic illness guide written by licensed clinical social worker Casey Berna, that is published by Sheldon Press, an imprint of John Murray Press, which is hitting stores this February. Berna has endometriosis too, and she describes her personal experience along with that of others in this book. Now, I believe in making informed choices for your well-being and health and everything. And in this regard, you can check out this book. This will work as a guideline or reference book to give you a summary of all the issues that are related to this subject. But there are other titles that are available online at, for example, Readings or Said Book Bank, and similar titles that are available on Amazon in various languages. As long as you do your research to get to a place where you don't fear this, so that you are in charge of your own health and the decisions that you make about it. Casey Berna dedicates this book to her daughter. She says, quote, "May disease or illness never make you doubt your self-worth. May you never mistake your lack of capacity for a lack of competence. May you always believe your lived experiences. May you never suffer fools who invalidate you. May you always feel loved." Unquote. According to an article published in Journal of Gynecology, Obstetrics and Human Reproduction in Volume 50, Issue Number 9, November 2021, co-authored by Mohammad Hassan Raza Raja, Nida Faruqi, Dr. Nadeem Zubairi, Musarrat Ashraf, Dr. Arfa Azhar, Rosina Beg, Bisma Badr, and Dr. Rehana Rehman, in Pakistan, the estimated prevalence of endometriosis is 16.8%. So even if we say that Pakistan's population is 250 million people, just a rough estimate, this is not an official one, of course. Half of the population is women. 16.8% means millions and millions of women are suffering from it. This, of course, is as per reported data, because most of endometrial patients are silent sufferers. For example, just last year, a symposium titled Endometriosis, a Conversation to Accelerate Action on Helping Women Who Are Suffering in Silence was held at Capital Hospital, Islamabad in March of last year. A news report on it was published in Dawn, dated March 10, 2025. It quoted Capital Hospital's Executive Director, Dr. Mohammad Nadeem Taj, as saying that, quote, "About 1 in 4 women undergoing laparoscopic procedures is diagnosed with endometriosis." He also pointed out that the disease remained poorly understood and inadequately addressed due to a number of factors, including insufficient medical knowledge, limited public awareness, inadequate research funding, and societal taboos surrounding women's reproductive health. In her keynote address, Professor Dr. Sayyida Batul Mazhar stressed the importance of early diagnosis and personalized management tailored to individual fertility desires and pain severity. She also stressed the positive impact of lifestyle modifications and advocated for accelerated programs focused on women's rights and empowerment, particularly in health-related matters, to ensure informed decision-making in disease management. Dr. Sheba Noreen, head of the Department of Obstetrics and Gynecology at Capital Hospital, addressed the diagnostic delays caused by societal stigma surrounding menstruation. Dr. Hadia Aziz, associate gynecologist, highlighted the societal invisibility of endometriosis sufferers, which denied them adequate health care and recognition of their pain. She emphasized the state's moral and political obligation to acknowledge their suffering and provide essential resources. Unquote. So the experience of Pakistani women is not that different from those in the rest of the world. According to the non-profit Endometriosis Foundation of America, endometriosis affects an estimated 200 million women worldwide and approximately 1 in 10 women in the US. That would be 6.5 to 9 million women, by the way, in America alone. Office on Women's Health, part of U.S. Department of Health and Human Services, quotes a study to give statistics on how prevalent this chronic disease is in America. I'm quoting it right now. It may affect more than 11% of American women between the ages of 15 and 44. This is mentioned in this study, Incidence of Endometriosis by Study Population and Diagnostic Method. World Health Organization quotes similar stats that it affects an estimated 10%, that is 190 million of reproductive age women worldwide. So whether it's 200 million or 190 million, there will be different statistics by different institutions, I guess. The bottom line is this, that it affects a huge majority of women. And what is important to remember is that on average, there is a 7 to 10 year delay in diagnosis. That is given on endofound.org website. 7 to 10 year delay in diagnosis. That's a hell of a long time to be unwell and unsure and scared. And there are plenty of books in the market on this subject in all kinds of languages. It's always good to consult your local health care worker, general physician, gynecologist, reproductive endocrinologist, functional medicine expert, or nutritionist too. I'm sure plenty of listeners are interested in finding as much info about it as possible, and in this regard, the book by Berna will comfort an affectee and enhance the possibilities of cure or manage the symptoms. She makes it a point to mention that, quote, endometriosis is not a gynecological subspecialty, unquote, on page 25, and how, quote, most of the healthcare providers do not learn much about it in medical school, unquote. That's on page 24. Now, this is something that is very important in relation to Pakistan, where the only recourse available to women is a gynecologist referral. No specialist or general physician is recommended or answers your questions. Not really. You'll have to go to a gynecologist and get yourself tested, and they will give whatever medication they think is good for you to reduce or eliminate the endometrial cyst. So even if you are single, unmarried, virgin, or non-sexually active, you still have to sit in a labor room or waiting area with married women who are either in some month of pregnancy or are trying to get pregnant. The gynecologist surgeon, whose specialty is maternal and fetal or baby care before and after pregnancy, not endometriosis, will have 5 minutes to do an ultrasound on your ovaries or pelvic region basically, or abdomen, to check for endometrial tissue. And you are only getting it checked on the advisement and direction of a general physician, since the GP has no such expertise or facility. Some gynecologists have their own fertility centers or IVF treatment facilities, and they are laser focused on profits of the baby-making machine. The clinic will be extremely crowded with no privacy, and the doctor will simply have no time to discuss your symptoms or anxieties or queries. They have scores of clients waiting. The OB-GYN surgery on ovaries to remove cysts or endometrial tissue may render you infertile completely, a risky gamble of a surgery. And all of this is because usually you are just referred to a gynecologist to talk about symptoms that may or may not be because of endometriosis. Now, Berna in this book differentiates between a general OB-GYN doctor who monitors pregnancies and deliver babies, and a gynecological oncologist who screens and treats cancer patients. However, there is no multidisciplinary specialist for endometriosis, and she acknowledges that in this book. She says on page 26 that American doctors usually rely on the Management of Endometriosis Practice Bulletin by American College of Obstetricians and Gynecologists, ACOG, to diagnose and treat endometriosis. By the way, the ACOG recommends that if pain is severe and does not go away even after treatment, then a hysterectomy, that is removal of ovaries, may be done. In fact, Berna says that, quote, so much of the research surrounding endometriosis and treatment for the disease are based on stopping menstruation or dramatically reducing estrogen levels, inducing menopause-like symptoms, or surgically removing our ovaries and or uterus to treat the disease. We are told time and again that if we can make it to menopause, we will feel better. Some of us are even encouraged to go through surgically induced menopause to be able to find relief from all of our endometriosis symptoms. Some people do feel better once they are in menopause. I often wonder how many of these people also had adenomyosis or other uterine-based conditions that did get better after menstruation stopped. We know that endometriosis, adhesions, fibrosis, and inflammation exists in menopausal patients. Unquote. There are a lot of myths around this disease. The most important thing to remember is that not everyone with endometriosis is infertile, as Casey Berna notes on page 43. The American Society of Reproductive Medicine estimates that 30 to 50% of women with endometriosis suffer from infertility, and 25 to 50% of women with infertility have endometriosis. But there are multiple factors that contribute to infertility in endometriosis patients, and Casey Berna goes on to describe all of them on pages 43 to 44. Even though endometriosis is normally discussed in relation to reduced fertility, Casey Berna defines it as, quote, a systemic inflammatory disease that can impact nearly every organ in the body. By definition, endometriosis is the presence of endometriotic lesions or tissues found in various locations outside of the uterus. These lesions are similar in nature to the tissue that lines the uterus, except endometriotic lesions create their own estrogen and stimulate the release of excess prostaglandins, which are hormone-like lipid fatty compounds, often inciting an inflammatory response from our own body's immune system. The inflammatory response is our body's way of trying to heal, yet the body is not able to eradicate the lesions. Pain, inflammation, organ dysfunctions, fibrosis, and adhesions commonly develop wherever endometriosis exists, and also contributes to systemic inflammation throughout the body. Unquote. This is given on pages 1 and 2. On page 2, she calls it, quote, an unwelcome intruder in the body and an excruciating and invasive disease that impacts 1 in 10 individuals assigned female at birth and less commonly has been found in cisgender males. Unquote. On page 4, she writes, quote, while endometriosis can impact fertility and sexual health, it is far from the only thing. It can impact the 10 other systems in the body, including the digestive system, the urinary system, the respiratory system, the cardiovascular system, the endocrine system, the lymphatic system, the nervous system, the musculoskeletal system, the immune system, and the integumentary system. Unquote. On pages 4 and 5, she says that it's not simply a hormone imbalance, that it's not a curable disease, that it's not just a white woman's disease or caused by sexual trauma, but most importantly, she writes that endometriosis is not just in the patient's head, as women sufferers are so often brushed aside on this pretext. Right at the beginning, at the start of the book, on page 1, Casey Berna quotes a 26-year-old woman's symptoms as following. You'll find real case studies and views of actual sufferers in this book, and this is one of them. The 26-year-old, identified as Morgan, says, quote, my whole body felt like it was falling and no one could tell me why. My periods were excruciating, making it extremely difficult to get out of bed. It felt like there was a mob of gremlins in my pelvis with metal cleats on, doing a punishing up-tempo jig in unison that left me swollen and hunched over for days. Throughout the month, I depended on anti-diarrhea medicine to leave the house, and when I did have a more solid bowel movement, it felt like it was covered in razor blades, tearing my rectum apart as it left my body. Often, after bigger meals, I would vomit, as if my system was rejecting the work it would take to digest. Nausea persisted. Sleep eluded me as I was getting up a few times a night to urinate. I also could feel my body ovulate, as if my ovaries were tearing apart with every cycle. Intercourse was so painful, yet my desire to overcome my struggle with infertility caused me to bear it. Tears flowing down my eyes, the pain would linger for hours. The fatigue was breathtaking, impeding daily tasks and constantly making me crave bedtime, which came earlier and earlier. Wearing pants was hard. Going more than 10 minutes in a car was hard. Eating was hard. Breathing without pain was hard. Being social was hard. Working and being in school was hard. Standing was hard. Sitting was hard. Existing was hard. And no doctor could tell me why. Unquote. And another one, aged 16, who is quoted on page 8 as giving her symptoms as, quote, "After a year of trying different birth control pills, the pain and other symptoms just got worse. We traveled out of state," that is she and her mom, "to see an endometriosis specialist who, through surgical excision of the disease, diagnosed me officially with endometriosis. It was throughout my entire pelvis, on my colon, my bladder, my rectum, and was causing my appendix, which had to be removed to stretch and adhere to other organs. My ovaries were also stuck to the back of my pelvic sidewall." Unquote. Casey Berna goes on to lay out the all-encompassing and diverse set of things a person feels when they have endometriosis on pages 7 and 8. These are symptoms that are related to different organs in the body, and I'm just going to read what she has written. Quote, "Symptoms vary, and in some cases severe endometriosis has been found in patients who report being asymptomatic. Pain is not necessarily related with disease severity, as even patients with a small amount of disease can have a great amount of pain. Symptoms may correlate to where endometriosis is in our body, although more clinical research needs to be done to support this. Symptoms often associated with the reproductive system, painful periods, painful ovulation, painful intercourse or penetration, pain with tampon insertion, chronic pelvic pain, infertility, pregnancy loss, ectopic pregnancy, adverse birth outcomes or complications such as preterm labor. Symptoms often associated with the digestive system include nausea, diarrhea, constipation, painful bowel movements, bloating. Symptoms often associated with disease impacting the urinary system, frequent urination, bladder pain, lower back pain. Symptoms often associated with disease impacting the respiratory system, chest pain, rib pain, lung collapse, difficulty breathing, coughing up blood. Symptoms often associated with disease impacting the nervous system, leg pain, hip pain, neuropathy. It's not uncommon for some patients to have these health issues as well: chronic fatigue, migraines, allergies, other comorbidities, especially adenomyosis, female bladder pain syndrome, appendicitis, cholecystectomy, and immune-related disorders." Unquote. And she writes on page 10 that, quote, "In our 30s and 40s, healthcare providers more readily recognize endometriosis if we are white and struggling with infertility, but by then the disease has been thriving in our bodies for decades." Unquote. And as you can see from the symptoms, when one is going through this, when one is showing these signs, they actually can be thought of or called as being something totally different because of the generic nature of these symptoms. Hence, a multidisciplinary treatment is required. On pages 17 to 31, Berna gives multidisciplinary treatment options available to affectees. She starts by naming the types and side effects or drawbacks of all medications that may be prescribed to an affectee. For example, the NSAIDs, the non-steroidal anti-inflammatory drugs, the combined hormonal contraceptives, progesterone and progestins, GnRH agonists, which put you in a menopause-like state, and GnRH antagonists, that is, drugs with significant side effects to the individual and their fetus. Surgical treatment options available for removal or excision of endometriosis, which according to Berna may include a team of a general surgeon, a colorectal surgeon, a urologist, and sometimes a cardiothoracic surgeon, while majority of OB-GYNs cauterize or burn the surface of the endometriosis lesions called the ablation technique. All of this is given on pages 21 to 22. But she writes on page 23 that even after doing all this, there is no guarantee that these options will reduce the symptoms and or reduce the chance of the disease progression to other parts of the body. But she recommends pelvic floor therapists and mental health practitioners, pain management specialists, acupuncturists, nutritionists, and functional medicine practitioners for a truly multidisciplinary care for endometriosis. On pages 65 to 90, she discusses the possibility of other chronic health issues simultaneously occurring with endometriosis and challenges in their proper diagnosis and treatment, such as adenomyosis, uterine fibroids, interstitial cystitis, female bladder pain syndrome, polycystic ovary syndrome, fibromyalgia syndrome, myalgic encephalomyelitis or chronic fatigue syndrome, hypermobile Ehlers-Danlos syndrome, postural orthostatic tachycardia syndrome, mast cell activation syndrome, even long COVID. Autoimmune disorders like lupus, rheumatoid arthritis, celiac disease, multiple sclerosis, inflammatory bowel disease, Addison's disease, Hashimoto's, thyroiditis, etc. can also coexist at the same time as and overlapping endometriosis. You'll see that the symptoms of these syndromes and disorders mirror those of endometriosis, with fatigue, pain, and gastrointestinal issues as a recurring theme. From pages 91 to 183, she goes on to talk about the toll all of this takes on mental health. A huge range of medical trauma is discussed. The needs of such an individual on a personal, familial, societal, and advocacy level are pointed out by her. Healthcare professionals can review the support protocol she wants them to follow, given in Appendix A on pages 185 to 188. So all in all, this book provides a summary of the multitude of issues surrounding the subject of endometriosis, and it will be helpful to anyone who wants quick, easy-to-read info on all basic aspects of the disease to better prepare on what to expect from one's own self and others. Thanks to the publisher for the ARC, and all the best to the author in her health journey as well as in helping others. And to all the listeners, especially women, good luck.